Hello, my name is Michelle About. I am main point 2, and my topic is diabetes. Let's lay some sustainable bricks in main point 2. We will now explore the solutions to a sustainable development in medications for diabetes and the statistics of it. According to the Mayo Clinic, diabetes depends on how high your blood sugar is, especially if you have prediabetes, type 1 or type 2 diabetes. I learned that type 1 and type 2 diabetes can be developed at any age. However, type 2 diabetes is most commonly known to be developed in people who are older than the age of 40. I also learned that the longer you have diabetes and the less control you have of your blood sugar, the higher the risk of complications you may have, which can lead to disabling or being at high risk of life-threatening complications. According to the World Health Organization, diabetes is the direct cause of 1.5 million deaths, and 48% of all deaths are due to diabetes that are occurred before the age of 70. According to a friend of mine who recently passed away at just the age of 18 during COVID, her name was Melanie. She was constantly going to doctors because of her blood sugar, and just everything was out of balance. There was not one single blood pressure, blood sugar. Her cholesterol was like over the top. It kept going up and down. She just kept going back and forth to the doctors, and her medications were not helping at all. And unfortunately, she had passed away. Drop a yes or no in the chat if you have lost someone due to diabetes and them being at high risk of complications. According to the CDC, the National Diabetes Statistics Report has provided information of the existing and new cases of diabetes with the key findings in each case. There has been an increase in new cases for people who are just the age from 18 to 19 years of age and have been diagnosed with diabetes for all racial and ethnic minority groups. The highest cases of diabetes has been amongst Black and Hispanic/Latino adults for both men and women. 69% of adults have been diagnosed with high blood pressure, and 44% have been diagnosed with high cholesterol levels. 39% of adults who have been diagnosed with diabetes have had chronic kidney disease, and 12% have reported vision impairment or blindness. According to the American Journal of Lifestyle Medicine, there are many ways to prevent getting diabetes with a sustainable diet and a physical activity that can help reduce being at risk of diabetes. Drop a D in the chat if you are in a diet or have ever been at a diet. Weight loss is the main way to prevent diabetes. It is explained in a 5-kilogram weight loss that reduced new cases to about 58% in the USDPP. It is recommended to lose a total of 7% of body fat for the primary prevention of diabetes. Drop a P or a W if you do any type of physical activity or any type of workouts. Exercising has been found to reduce hemoglobin by 67% among patients with diabetes. It also improves the beta cell function and insulin sensitivity for patients who are at high risk. According to Better Health, losing any type, even like the smallest amount of weight, especially around your abdominal area, it helps lower your blood pressure, blood glucose, and your cholesterol levels. It is recommended to do any type of physical activity for at least 30 minutes. Drop a 30 in the chat if you work out for at least 30 minutes a day. The minimum recommended time for losing weight is 60 minutes a day. It is important to make sure which physical activity is sustainable for the patient. They must first check with the doctors, of course. The types of physical activities that a patient can do is walk, swim, or any gym workout. If the patient is not able or possible to do any type of those to any type of physical activities, there are many substitutes like aerobics, chair exercises, and strength resistance with light weight.